Respected Chair, dear President, I would like to thank the organizing committee and the international and the local one, and especially Professor Tsitska, with whom I had the privilege to work with in the adolescent unit as a pediatric endocrinologist. So we're going to speak about endocrine disruptors, and this is a very disrupting image from our brain. It was issued just this September, showing a microplastic in our olfactory bulbs. So I remind you that olfactory bulbs have neurons that originate from the same origin, such as GnRH neurons. And it seems like microplastics have a preference for our tissue in the brain. So there is a tip of the iceberg about endocrine disruptors because we know something about only 5% of the known or unknown more than 16,000 chemicals, and that there are 3 or 4 major ways of action for the endocrine disruptors. Normally, the hormone goes to find the receptor, and you have a result. You have endocrine disrupting when the endocrine disruptor bounds to the receptor and impairs the hormone bind, or you have an estrogenic effect, for example, so it activates the receptor, or it translates the our DNA by working in other receptors I will show you about, and downregulates the expression of the receptor. And so it blocks the expression of the receptor. So plastics are a crucial source of disease, and we have 5 major categories. Bisphenols, we remember all bisphenol A, phthalates, used in food packaging, PFAS, used in non-stick cooking plastic material, brominated flaming retardants, and of course, burning plastics. So bisphenols, what do? They increase fat cell size, disrupt adiponectin, and they have a low-grade estrogenic activity. Bisphenol A induces apoptosis of ovarian granulosa cells, and that's why it disrupts so much the reproductive system. We may got rid of BPA, but 40 similar replacements, BPS, BPF, BPAF, BPZ, are used right now, and BP substitutes are more than 140 with similar estrogenicity and embryotoxicity. So bisphenol A and its analogs, it's very important to understand that they activate a human pregnein receptor, which is a nuclear receptor like the retinoid X receptor, like the vitamin D receptor. So it means that these receptors, what do? They regulate how our genes will be translated. So bisphenols contribute to cardiovascular mortality, for one, because they invade directly the carotids. And so we have already seen images like the last one in our carotids, even as early as 12 years old, and in the elderly, of course. And they increase the risk for type 2 diabetes, the coronary artery disease, and all-cause and cardiovascular disease mortality. The phthalates are divided in 2 major categories: the low molecular weight, which are the shampoos, the cosmetics, the lotions we use every day to prevent axillary odor. They have anti-androgenic properties, reducing androgen receptor transcription, and in high molecular weight, like those we use in beef flooring, food wrap membranes, and in medicine for IV tubing. So DHEP, HP, a metabolite of high molecular weight used in food packaging, increases expression of a key role receptors in lipid and carbohydrate metabolism having an obesogenic activity. So both of them, the D and the mono phthalates, are harmful, particularly in pregnant women, because they impair placental development, they alterate placental functions, and they are associated with pregnancy disorders. The obesogenic effects in lipid metabolism and transport are mediated mainly through PPAR gamma, which we know from type 2 diabetes, and through the reacting oxygen species they produce, leading to oxidative stress, leading to cell apoptosis, and further cell destruction. So also, they activate the NFKB. NFKB is a major transcription factor involved in the pituitary, in the immune system, and they also disrupt the thyroid hormone signaling and directly the trophoblastic cell populations. What about preterm birth? We know that at least 57,000 preterm birth cases in 2018 were in the US. And we know, and it is proven, that preterm birth risk is associated with an increase by 1.45, so 45% higher in those pregnant women which are found with phthalates in their bloods. They contribute to cardiovascular mortality directly, as we said before, but also by inducing hypogonadism. So we spoke about microplastics in the carotid artery, and the other way is that they lower testosterone, which is low testosterone, a predictor or a marker of cardiovascular disease in adult men. So phthalates are associated with a lower bioavailable testosterone in men over 60 years of age. And if we have disruption of male fetal or male mini-puberty, I'm showing you the three phases of puberty in humans. We have a fetal phase, which is between 8 to 24 weeks of gestation, a male and female mini-puberty, which starts around 15 days of age until approximately 6 months of age, a little more extended in females. And if we have a disruption in those two phases, fetal phase and the mini-puberty phase, which means we have low testosterone in that phase, estrogenic activity, reduced expression of the androgen receptor, this could lead to micropenis, disorders of sex development, and can contribute to altered sexual orientation and disorders of sex identity as well, which we see more and more. So this could be an example of endocrine disruption. Here you can see a newborn which has an urethra, has a residual vagina, has a small but normal penis, has cryptorchidism from the one side. He is 46XY, WS negative. He has normal mini-puberty, normal adrenal steroidogenesis, normal transformation of testo to DHT, normal function of the testis, and normal appearance and biopsy of the testis. So there is no apparent reason for this. And one reason could be the endocrine disruption. What about PFAS? PFAS are used mainly in non-sticking cooking and plastics. And we must be very alarmed because they are detectable in the blood more than 96% of the US population. And the major thing that they do is that they lead to low birth weight. And almost 500,000 cases per year of low birth weight are linked to PFAS. They also have an obesogenic activity, inducing reduction in metabolic rates and increase the type 2 diabetes incidence by 14%. And this is an RCT, this is hard data. Brominated flame retardants are used extensively. And one thing they really do is disrupting thyroid hormone signaling. But we know that if thyroid hormone signal is disrupted, then we may have a global IQ deficit, increased autism spectrum disorders, and attention deficit hyperactivity disorder cases. And especially this one, VDE 209, may have a toxic effect also by inducing tumorigenesis in the thyroid. So it's not only the signals, but tumors as well. Let me say a few words about how is this translating to everyday pediatric endocrine clinical practice. Right now, 40% of our children are overweight or obese. We know that pubertal onset, especially in girls, is shifting to the left. This is proven. And we know that there is a role for the endocrine disruptive chemicals in that earlier starting of B2 in girls. Although the major determinant of early puberty is the pattern of growth, which has been described as constitutional advancement of growth. However, this constitutional advancement of growth, you see it on the left, which means that the child is born and until between 3 and 5 gets to the higher curve, higher than its target height, and bone age is more mature than his age. Okay, this is connected, very much interconnected with early adiposity rebound, and early adiposity rebound is that term in the BMI. And if we have early adiposity rebound, then we will have premature adrenarche as well. And if we have premature adrenarche, we know that this system will also wake up central puberty. And this is the classical evolution of a BMI and early adiposity rebound found in SGA and low birth weight children, to connect with all the previous things we said about low birth weight and endocrine disruptors. So we must identify the endocrine SGA child, which means everyone which is born more or equal to 35 weeks of gestation and is below 2.5 kilos and or 48 centimeters. We need to define this as a possible endocrine SGA child and follow his growth curves, because this leads to premature adrenarche, earlier puberty, advanced bone maturation, and short stature. And also we know that if we have increased androgens, these androgens, and now we know much more about the backdoor androgen steroidogenesis, we know that these androgens, apart from the already known transformation of testosterone to estradiol and androstenedione to estrogen, which is done by aromatase in the lipid tissue mostly, and in peripheral tissues as well, we know that androgens like these ones, they have direct estrogenic activity. So endocrine disrupting can have an estrogen activity also through androgens. And there are pitfalls also in the diagnosis of precocious puberty in obesity, because in obesity we have increased aromatase activity, low SHBG, increased leptin with central resistance to leptin, all these leading to increased estradiol and lowering of the GnRH pulsing. And we have problems in diagnosing in the laboratory precocious puberty in terms of measuring the basal levels of the LH. But in boys, we have a bigger problem. We have hypogonadotropic hypogonadism, because we have disruption because testosterone is transformed to estradiol by aromatase, and we know that estradiol is the most potent regulator of LH and FSH secretion. And subsequently, we have micropenis, we have a boy with small testes with obesity, And it's a vicious cycle, less testosterone, more obesity, and compromised fertility in the end. And this vicious cycle has to do also with all the hypothalamic and pituitary resistance in leptin we have, and inflammation, which happens also in obesity and not just elevated estradiol. The advanced bone maturation can be measured, and we can also measure bone health index now with AI tools, with the bone age X-ray. And I'm closing my presentation by showing that with data in fewer than 5% of EDCs, we have data only for them. And that's why we say this is the tip of the iceberg. Maybe the cost by health effect in the EU is around 160 billion euros. And this is almost double in the US, because the US is always a little bit behind in its policies. They need to prove that something does something to forbid it or to prevent it, whereas Europe acts a little bit faster if there are indices that something is going wrong with something, then we move more quickly. How much of the disease burden due to endocrine disruptors is due to plastic? Almost everything. As we can see, for BPA, it's 97.5%, DHCP 98%, phthalates 100%, PPD 98%, the PFAS 93%. The good thing is that there is a UN initiative to end plastic pollution. So by the end of the year, there will be a new meeting, hopefully the last one, which will take place in Korea. And we hope that this will lead to a new plastics treaty, which governments all over the world in the UN will sign and will implement to protect children from endocrine disruptors. Thank you.